Mechanical Engineering from the University of Montreal. She is trained engineer and scientist in multidisciplinary work, and she has authored several publications in engineering and neuroscience journals and presented in several international conferences. And also, she is the senior lecturer at Electrical and Information Engineering Department from University of Ruhuna. So, Ms. Prince, so I am inviting you to the virtual podium to start the discussion. So, actually, I'm having some network interference, so apologizing for that too. So, Dr. Prince, first, can you explain about the career journey that you have gone so far, and how did you came to this position so far, to the audience, please?
Thank you, Vidura. Thank you for inviting me, and thank you all for being here. So, like Vidura said, my first degree was mechanical engineering, and I loved doing mechanical engineering calculations, very specifically mechanics. And I was looking at PhDs to do in biomechanics, because I thought I was working in the industry as a mechanical engineer, and I thought the heavy machinery stuff I had already done, and it was kind of getting boring at one point. So I thought, let me move to the human body. And at that point, I was looking for PhD positions, and I started my higher studies in biomedical engineering, but I couldn't find a lab that I liked doing biomechanics. So the next best thing, I think, for me was electrical engineering. So I moved to an electrical engineering lab, which was doing neural engineering. After 2 weeks at that lab, I loved it. And I think that was one of the best decisions in my life. So there I learned how to do surgeries, how to do like a lot of the programming skills that I didn't have, a lot of the electrical engineering background, and also how to apply this to human beings. So I did animal surgeries overseas, but I also got a chance to work with humans. So I think that was the start of my career here.
Yeah, very interesting journey then. You know, that starting from the mechanical engineering, then directed to electronic engineering because of the neuroengineering. So that's fascinating. So apart from that, can you explain? So come into the discussion. What is neuroengineering then? What is the purpose of this, and how it came to the world? And the basic, can you give us a basic idea to the audience? What is it, please?
Yeah, so neuroengineering is pretty much engineering applied to the nervous system. So anything at all, really, you can think about, any interaction with the nervous system, either to restore the nervous system, to repair the damages, or even enhance the nervous system. So one of the most widely used neuro devices, we call them neuro devices now, is the cochlear implant. I'm sure some of you may have heard of it, or you may even know of people who has cochlear implants here in Sri Lanka. This is basically if you're not able to hear. So in our ear, there's a piece called the cochlea. That's what helps hearing. That's what takes the signals from the outside, the sound signals, and converts it into electrical impulses for the brain to understand it as hearing. So if there's something wrong with the cochlea, you can't hear. What you can do is you can replace this with an artificial cochlear implant. And this actually was one of the very first neuro devices in the world. And to this day, it's the most widely used neuro device. So I think that would have been, even in Sri Lanka, it has been used, I think, for more than 40 years now. I think that would be one of the starting places, and also one of the most successful applications of neuroengineering.
So yeah, so that's the introduction of the neuroengineering. So we could, audience could understand what is the neuroengineering. So talking about the neuroengineering, we heard that in 16th, 17th century, our equipments are, I mean, talking about the medical application. So they are so bad. Many deaths were happening around the world. You know that talking about 14th century Black Plague almost killed 200 million. So talking about that, the recent researchers said the implication of neuroengineering, that because there are low focus on implication of neuroengineering, many deaths were happened in past. But now we are living in the 21st century, so we are using cutting edge technology to do these things. So can you explain? So regarding the neuro engineering, what are the things cutting edge technology? So we are talking now artificial intelligence, recent trend. So how can we use artificial intelligence or machine learning implications on this neuroengineering field? Can you explain?
Yeah, so I'm going to talk more about this in my talk. So I'll be very, very brief. Neuroengineering is full of artificial intelligence and machine learning. So I think that's the foundation. Actually, I would say the foundation is signal processing, and build on that is machine learning. And we need machine learning to do pretty much everything in neuroengineering, starting from neuro devices to different applications that we have, things that work in conjunction with the nervous system, things that interact with the nervous system. We need to know what can you learn from the past of that particular device or the past of that particular signals that you're collecting, and how do you interact with the nervous system in a way that is beneficial for the person. So machine learning is used very heavily for that. It's actually all about machine learning, if I should say, but not only about machine learning. Right? Okay.
Yeah, so according to you that so neuroengineering is not just just a single piece of subject. So it just contains many subjects. So that it's like a neuron, isn't it? That what you're explaining is neuroengineering. It's like itself. So yeah. So kind of that. Can you explain that? That we are in 2021 actually. So we are. I mean, we cannot forget that this technology, this neuroengineering field is expanding. But what will happen? I mean, in this. I mean, that artificial intelligence and machine learning trends. I mean, when I was reading an article back a week, that the reason, I mean, one of the article mentioned that image processing that and other feature detection are in the most of this success in 2010 or 2012. So it says that artificial intelligence and machine learning concepts are old, but its applications are now it is now this century is the upcoming era of that artificial intelligence and machine learning. So 2010, 2015, many companies have created, and that likewise. So can you please explain more about what are the, I mean, scenarios, examples that neuroengineering can be used in this, in the field? I mean, applications and scenarios. Actually, you explained about the theoretical, so we want to know about the actual scenarios.
So yes, I think you gave like a very current and relevant application of medical imaging. Like machine learning and artificial intelligence is actually revolutionizing the medical industry at this point. Medical imaging is one of them. Radiology, they have, I have a few slides on that also during the presentation I can show. In the field of medical imaging, previously radiologists would sit down and look at each single medical image. And there were lots of misdiagnoses. Not only were there misdiagnoses, but a lot of times the diagnosis was slow. There was a lot of things getting backed up. And also there's only so much experience that one surgeon or one radiologist can have. So artificial intelligence has come up as a solution to tackle all three problems. So you can see that now diagnostics of diseases using medical images is completely done by artificial intelligence. You still have a trained medical professional looking at it, but all the information given to him or her is done through artificial intelligence.
Oh, okay. So, yeah, we can understood that. So I heard that there are some relative words according to, I mean, the bioengineering. So, I mean, can you explain that neurobiohybrids, and there are some other words called. So, I mean, that those are the, I mean, according to the 2018, the open AI from the Elon Musk. So it's its initiative. So the open, according to Open AI Institute, they suggested that they should invest more in the uh, these neurobiohybrids and their Neuralink, their other startup, I mean other company. So Open AI and Neuralink, they are combined with together, and the studies say they were actually planning on something and biohybrids. So can you please explain on that? What is that?
What was the word you were asking for? Bioengineering?
Yeah, neurobiohybrids.
Okay. So you also asked about bioengineering. Bioengineering is the same thing as biomedical engineering. I think whether you work in more European sector or American sector, the wording can be slightly different. Previously, it was very well known as bioengineering, but now it's very common to be known as biomedical engineering. And when you talk about hybrid devices, there's something called symbiosis. This might be a little bit too technical, so therefore I didn't put too much detail in my slides for that. But it's this concept of you can have both the brain and the artificial intelligent agent both learning at the same time. So if, especially when we use this for therapeutic applications, we want to make sure that we don't stop the development of the brain. We don't want to stop neurons in the brain making connections further by letting artificial intelligence take over everything. So we want kind of a hybrid system where you have the person, the human person, doing a fair bit of work. And as this person is not able to do, we let the artificial intelligence take over. And if by chance the human person is able to do some of the work again, the component of the artificial intelligence will reduce. So this way you have a balance between the two. This is like, unfortunately, with the current technologies, some of you, actually all of you are in the current generation. The students in the current generation might not be familiar with some of the older technologies that were used to do some of the work that you do with your phone. Computers have come in. All of the calculations previously were done with other technologies, but the brain was much more heavily involved. Whereas now, because the technology does everything, your brain does very little thinking. So for example, if you had to add, I don't know, say just a number, 123 plus 123, actually, I don't, let's say 123 into 123, I don't know that many people who can do it mentally anymore, because you have not been taught that process of how to enhance your brain power. Whereas if you ask somebody from previous generation, like your grandparents or your great-grandparents, for them, it's like, yeah, this is a no-brainer. Like, why would you use a calculator for such a simple calculation? Whereas today, even for, I have seen students, even for 50 plus 50, sometimes will use a calculator. So we shouldn't go into either extreme where we are completely relying on the artificial agent, or we're completely relying on the human brain. There might be something, especially when you think about diseases or recovery, that the human brain is not able to do. So artificial intelligence at that place comes alongside the human brain to do some of the work that the human brain cannot. But if we realize that the human brain is able to do some of those work, we should reduce the component of the artificial intelligence. So that way we're going towards a hybrid system. Another word we call for this is symbiosis.
Symbiosis. Okay. So yeah, great explanation. So yeah.
You were asking about Elon Musk. I think recently, because Elon Musk has, it all has to do with the economics of it. Wherever the money is, you hear more about it, and that's where the media also gives more coverage. But the brain-computer interfaces didn't start in this century. It started at the latter part of the last century. Even EEG dates back to 1800s. And I think the first, I might be wrong in this, I think the first brain-computer interface was implemented in a human in 1998, if I'm correct. In the 1970s, brain-computer interfaces already existed, but with animals. So there were monkeys playing computer games using brain-computer interfaces. So it's not a new technology, but it's only now. If you know a little bit about the research world, currently in the last decade, a lot of money has been put in different countries to do neuroscience research. So like the Brain Initiative in US is one of them. When Obama came into power, he actually said this year, the previous decade was the one where we went to the moon. This one, we are going to focus on the brain, on the nervous system. So a lot of funding came in for research with the Brain Initiative. Then you have the Human Brain Project in Europe, which is a similar one. Similarly, China and Japan also have their own brain initiatives. If you basically their research, the drive for the research to do neuroscience research. Part of that, so not everything, but a large component of that is neural engineering and brain-computer interfaces. So Elon Musk coming in is actually a result of all the funding that has gone into develop that area. So one thing he has done is take it at a very different, a very large scale into the private sector, into the media, which at the research level, a lot of researchers were not able to do, or were doing at a very smaller level.
That's right. Okay, now we understand. So, yeah, and also I had to remind that to audience that you can ask any question that you have for Dr. Prince. She will be happy to answer all question. You can just unmute yourself, or you can just type in the chat if you like. And yeah, all about the neuroengineering. So I have already have a question from private message. So one of participants asked that can you explain the image processing power? How can we use the image processing power in the neuroengineering? Can you explain? Like you are unmute. You are mute.
Sorry, I would like to know what background most of you have. Actually, so is it mostly an engineering background, electrical engineering, different disciplines? Is it possible for some of you to unmute your mics and give me some idea?
I think mostly undergrad, IT undergraduates and engineering undergraduates we have here.
Okay, so some from a technical background. Are they familiar with machine learning? Have they studied machine learning? Let me ask you, Vidra, how familiar are you with machine learning techniques and the actual algorithms and the maths that go into it?
Personally, I'm okay with, but I'm just thinking about the audience. So audience, I mean, when we get the feedback, it's all right. But when audience, then When you have a problem, just ask from Dr. Prince, then she will be happy to explain.
Shall I get started with the presentation? Then that would give a general background of the topic so that students can ask more questions.
Yeah, it's a good.
Okay. You can see my screen?
Yes, you can see me. You can proceed.
Yeah. Okay, so welcome again. And like Vidura said, I'm Dr. Prince. Let's get on with some of the basics of neural engineering. So I'll give a very brief introduction to some of the neuroscience and the theory behind neural engineering from a biological perspective. Then we'll look at some of the electrophysiological recordings. Then we'll talk about the machine learning and how it can be used. Then I'll talk about some of the other research tools that are being developed. So maybe some of you, if you're undergrads who might be interested in going for higher studies, this might be useful for you. And then we'll also talk about career paths, the subjects you need to talk about or you need to learn while you're in campus if you're interested in some of these. So going to the introduction. Neural engineering, like I said, or this is also called neuro engineering, same thing. This is to improve health and quality of life. And I said we can do replacement, where in the case of somebody who has lost his or her arm, you can replace the human arm. You can restore the human arm. In the sense, if you have paralysis, if you're paralyzed on one side, or if you're paralyzed even in one hand, you can restore the hand back to its original function. The third thing is you can enhance. So if it's a healthy person and this person does not have any disease, you can enhance the working of the nervous system. I'm going to talk about all the way at the end. So these are the three things that neural engineering does. You need neuroscience and you need engineering both. And we have engineers, neuroscientists, clinicians, surgeons, like a whole area of medical personnel, including nurses and caregivers. So don't think that neural engineering is just an engineering side or a neuroscience side. You need a lot of medical professionals who might not have understanding of neuroscience or engineering. For example, nurses and caregivers. They are very vital if you expect neural engineering to be established as a therapy or like as a field. So talking about the nervous system, I only have 2 slides about basic neuroscience. Talking about the nervous system, you have 2 parts. One is the central nervous system, which comprises of the brain and the spinal cord. Then you have the peripheral nervous system that's talking about all the nerves that go to everywhere in the human body. So you can have neural devices that interact with any of these things. So how neuro devices interact with the central nervous system is different from how it interacts with the peripheral nervous system. I'm not going to go into detail about that, but this is something to keep in mind, that this is, but the brain is the most complex of the organs of the human body. And even in that, you have specialized areas, specialized things to do different things. I do see there's a chat. I have this kind of rule in my lectures. It distracts me. So if there are questions in the chat, I'll take all of it at the end. But if any of you have anything to say during the lecture or ask me, please feel free to unmute yourself and ask the question. If it comes in the chat, it will have to wait all the way till the end. I do see notifications coming, but I've completely put it aside because it's usually distracting for the talk. Okay, neurons and communication. So neurons is the basic building block of the nervous system. And how neurons communicate is through electrical impulses. I'm not going to go into the biochemistry or details about it, but just know. So if some of you who remember O-level science will remember the basic anatomy of a neuron. This is the nerve cell. A neuron is a nerve cell, the cell in the nervous system. Just as much as you have cells in plants, you have other cells in other parts of the human body. A neuron is a cell in the nervous system. And you have the cell body, the cytoplasm, all of these things are there. For us as neural engineers, or at least for artificial, since the audience is mostly related to engineering and IT, I will skip all of that. I will just summarize this slide as, just know that there's both chemical messages. So this is the synapse. Again, if some of you remember, the synapse is where one neuron will talk to another neuron. That connection is actually a chemical connection. This chemical connection is converted to an electrical impulse inside the neuron. And through the neuron, the message is passed as electricity or through ions as an electrical signal. This is what we use to record. So this electrical signal or the electrical impulse is what we record in order to understand or interpret the signals of the nervous system. So electrophysiology and imaging techniques. So electrophysiology is really how do you record these signals of the nervous system. That's what electrophysiology is. So there are different techniques. Here's like at a glance, everything that you can record from the human nervous or the nervous system. You have spatial resolution and temporal resolution. So EEG, for example, is something very, very common. This was started, like I said, back in the 1800s, I think 1870s or 1890s was the first EEG that was recorded. What you do is you put an electrode on the scalp of a person or an animal and you record, just like you would record the signal from any circuit. So this is recording the electrical impulses of the nervous system or the neural circuitry. You can also go inside. You can open up the scalp and go inside and put electrodes there. That's what you call ECOG. You can also go inside the brain and collect signals. We call that LFPs or spikes. So on this side, you have all the non-invasive techniques, and on this side, you have the invasive techniques. There you go. Hopefully, that improved the resolution a little bit. Okay. We also have imaging techniques, fMRI, MEG. These are non-invasive imaging techniques, and we also have optical imaging. I'll talk about these in my presentation. Any questions so far? Actually, let me take questions after I explain what each of these things are. So the first thing, I already gave an introduction to EEG. This is completely safe, unless, of course, you have skin rashes or something, in which case when you try to get the connection and you rub a little bit of rubbing alcohol or isopropyl alcohol to clean the head, you might have some allergic reaction. But other than that, EEGs are completely safe, even for babies. So here you see a baby with a high density EEG array. Some of these techniques are wireless. So some you will see there's a wire connected to this. There's a wire connected to this, and there's a computer at the other end. In most cases, the connection will be wireless. So you can go about doing your normal activity. Again, it depends on what you're trying to diagnose. And wireless techniques can be very helpful when it comes to babies, because you have to have a net or an EEG system that you can put on the baby very easily. that it won't hurt the baby, that the baby doesn't feel like there's something like pressing the skull. So these techniques are very useful, even for adults who have psychiatric illnesses, or even if you don't have psychiatric illnesses. I'm sure you don't want to do a test with everything that's hurting your head. If you can do without being something that's going to hurt your head, you most probably would like to do the test. So think about the medical tests that you have done. The tests that you think are more painful, you're less likely to do. And therefore, you probably will stay with the illness or the disease without getting diagnosed because you're afraid of the test. So EEG, on the other hand, you don't need to be afraid of it. So therefore, a lot more people are more likely to go get the test done and get proper diagnosis. So this is useful. And the reason I'm saying this is, again, for an audience, student audience related to IT and engineering, it's important that you get into research and innovations. And these are some of the factors that you need to, the human factors you need to consider in your innovations. Another technique is ECOG, or electrocardiography. These words are very difficult to pronounce. You open up the brain, or you open up the skull, and you put the electrodes on the surface of the brain. And then you close this up and you can collect data. You get a better resolution because you're going, so when you collect EEG, it's completely non-invasive. But because your scalp is filtering that information, you don't get a lot of the data. So because of that, you can open up and go onto the brain. The next technique is you can even put electrodes inside the brain. So here, I don't know if you can see the electrodes that are sticking out. So these are like tiny electrodes sticking out like this. The width of them is probably twice the width of the human hair. So they're very, very tiny. And this is a human finger, index finger, if you can notice. So this you can put inside the brain, several millimeters or centimeters into the brain to collect data. You can get better resolution, information that you could not get with EEG, you can get with this. But at the same time, these are very specialized things. You don't always need to go inside the brain to get information. Sometimes getting information from the surface might be enough. Especially if you have a high density array like this, you can do a lot of mathematical modeling to get information just as good as what you would get by going inside the brain. So when we talk about the last section that I talk about, how do you get into this area? I talk about mathematical modeling. So this is one area that mathematical modeling can do a huge impact, because from invasive recordings, you can move to non-invasive recording while keeping the same quality of recording. We talked about brain imaging. So there are different types of brain imaging. Even though this is a human body, you can use the same techniques for the brain. Let me actually have all of these pictures there. You have something called magnetic resonance imaging. You have a equipment like this. Maybe some of you have gone through some of these tests, or you know somebody who has gone through these tests. There's a magnet inside this. And in this magnet, once you put the patients, when you turn on the magnet, the water molecules in your body will align in a certain way. And through that, you can get images. And these images can give you the structure and the function of the brain. So if it's just the structure, we call it the anatomical MRI. If it also gives you the functional information, like in this picture, we call it the functional MRI, fMRI. There are other techniques like CT. It's a similar equipment like this. Instead of a magnet, you have a series of X-rays. And these X-rays will take, so this is what we call a CT or a CAT scan. The series of X-rays will take a series of images. And what you do is, using mathematical modeling, you can recompose a 3D image of the brain. You can also have MEG, that's also a magnetic technique. You can have PET. This is PET is a nuclear medicine. So all of the equipment look like this, but what's inside the equipment will change depending on the test. So if you take a nuclear medicine imaging or nuclear image of the brain, it will look something like this. You want to study which areas of the brain has absorbed certain isotopes. You combine that with a MRI, you can get anatomical and functional images both. Okay, so let me actually one more imaging modality before I pause is optical techniques. You can use light to also get information. And if you know, especially in telecommunication, optics is used to carry information. This is no different. You use optical techniques. This is called optical imaging and optogenetics both. Optical imaging is basically reading what's in the human brain just as much as you would read it from a electrical source. You're trying to get it using optics. You also have something called optogenetics, where you can with electricity, you can stimulate the brain, but you can also stimulate the brain using optics. That's what optogenetics is. Using optogenetics, you can turn on and turn off certain gene expressions. Okay, so let me pause here and take some questions before we go into the machine learning aspects of it. Actually, Vidura,
also,
if you can, yeah.
I have a message to announce that we have prepared. Okay. No, go on, madam.
No, carry on.
Okay,
if you want to look at the chat and just read out the chat questions, that's fine too.
Yeah. No, we have prepared the feedback form, so you can put it your question in that feedback form. So at the Q&A session, then we can read the questions and clarify any doubts or questions. So we'll put it in the chat now. Then you can just audience can just fill in the form and at the Q&A section, then we can discuss. I think, madam, you can proceed with the machine learning aspect, so they can.
Okay. So I just want to make sure that you don't have any burning questions about understanding, because that would be really sad if I keep going without you understanding the basics. If that's the case, please feel free to put in the chat, and I would ask Vidura to just read it out, or you can even unmute your mic and ask your question. Okay, so moving on to the machine learning aspects. Everything that I'm about to tell you in this section is using machine learning. And I'm sure, given an IT audience, you're familiar with the difference between data science, artificial intelligence, and machine learning. But just to give you like a 30-second overview, artificial intelligence encompasses a lot more than machine learning. So when you use machine learning, so if I were to draw, let's say, a Venn diagram, machine learning would be the smaller one here, quite a big aspect of it. And then artificial intelligence would be the larger circle. Okay. What do you know about prosthetics? What are prosthetics? Forget neuroprosthetics, but what are prosthetics? I need some feedback now. I've been talking for more than half an hour. Do students not talk at these sessions?
You can talk, okay, so no need to afraid the something.
No. So basically a prosthetic which communicates with the nervous, a prosthetic is something you use. You can replace an arm. That would be a prosthetic. But you can also use a prosthetic as a brace to support the arm. So all of these are prosthetics. Neuroprosthetics are any of those prosthetics that communicate with the nervous system. And I said we can use this to repair, to replace, or to even enhance the nervous system. So we are going to talk about 3 different neuroprosthetics: sensory, motor, and cognitive. Sensory means you're getting sensory information. You're getting the information in. Motor means you're giving the information out. You're using this to control something. Cognitive neuroprosthetics is what cognitive means thinking. That's what the word cognition means. So cognitive neuroprosthetics are things that affect, interact at a deeper level. So sensory neuroprosthetics, try to go fast so that we can leave some time for the Q&A session. Visual implants. Here you get the information, or you get visual inputs from the environment. So this can be in terms of a camera. This is an example. You can get information from a camera and you can convert this, or you can analyze these signals and convert it into a way that the nervous system can understand. In other words, the visual implant will interact with the retina. That's where your electrodes will go. Like I said at the beginning of the lecture, cochlear implants. This has been the most successful neuroprosthetic to this day, actually. So you have 2 parts. You have the what do you call the receiver externally, but you also have the receiver internally. You also have a receiver. So you have a receiver. Let me see if I can. So you have the receiver here to collect the sound. Once it collects the sound, there's a transmitter. This is also an external. It looks like a hearing aid. Here we go. The transmitter, which will transmit through the skin to a receiver inside the person. And that converts the signals to electrical impulses that can stimulate the cochlea. Another thing is bladder control implants. For people who are not able to have their bladder control, this is actually a very successful implant. You can have a neuro device that's going to control. So once the bladder is full, you can actually have this person urinating. Otherwise, this person, either the bladder will explode and the person will die. You can have an aneurysm and die, or this person will start leaking. So a solution to both of that is having a neuro device. So rather than having a bag connected to the person, you can have an implant. Just want to share with you again, because we were talking about the machine learning aspects of it. I want to talk about the signal processing of cochlear implants again very briefly. As I said, there's a microphone and you have the speech processor and a transmitter. So up to here is external. All of this is done externally. So a lot of machine learning can go into this part. A lot of signal processing goes in. The machine learning part actually is to make sure that you fine tune. So if you have signal processing which goes one direction, you can record the sound, you can process it, you can send it across to the cochlear implant. The machine learning aspects will actually come in to fine tune it. How can we improve the speech processing? All of the artificial intelligence goes into that. That's one aspect. The second aspect of research is how do we improve this part? This is the cochlear implant, what goes inside the person. How do we get the most out of this speech processor? And how do we make sure that with the least amount of resources, you can get the most amount of benefit for a person? Let me see if... So I'm going to play a short video clip that will compare what a normal person would hear, or the sound that we hear, and also the sound from a cochlear implant. Depending on how many channels you have in the cochlear implant, the sound can be better.
A pot of tea helps to pass the evening.
Did you hear the sound?
Yeah, we can hear. We can hear.
A pot of tea helps to pass the evening. A pot of tea helps to pass the evening.
It is really all in the name of science.
Okay, hopefully that gives you an idea about what it is like for a person with a cochlear implant to hear. So it's not the same way that you and I can hear, but things again can be improved a lot. In Sri Lanka, like I said, the first, actually in the world, 1978, the first cochlear implant was done in Australia. In Sri Lanka, we have about probably more than 400 patients with about 2 surgeries every week being done, at least before COVID, that was the situation. They do it at Peradeniya and also at Lady Ridgeway. So this is very common in Sri Lanka. Motor neuroprosthetics is basically where you use the signals from the brain to control some device. So the motor part of it is actually the controlling of the device. So in this case, this is like a conceptual idea where you can record from a person's brain. I don't think you can see the arrow that's going there. You can record from a person's brain. You can put a small computer either externally or internally, and you can have a paralyzed person do movements with their paralyzed hand. So in this case, this has not been achieved yet, but this is conceptual. You can even get the person to do very fine movements like tying a shoelace. Some of the things that we take for granted is very difficult. Like if you know somebody who's paralyzed, you realize like some of these things, how much we take it for granted. So here are some other uses. You can use the signals from the nervous system. It doesn't have to be the brain. It can be the spinal cord. It can be from the peripheral nerves. Any of these things, like that was my very first introductory slide. You can send the signals to a robot, like an exoskeleton that will walk the person. Here is the case of artificial implants. Artificial prosthetics, you can have them communicate with the nervous system. You can, so these are some of the extreme cases, but you can also use this for neurorehabilitation. I'll talk about it later, but for things like stroke. This is actually a very widely researched subject. What other areas can we use brain-computer interfaces and neuroprosthetics? So these are what neuroprosthetics are. The hub of it, or the key component of it, is brain-machine interfaces or brain-computer interfaces. I forgot to mention this earlier, but brain-machine interfaces BMI or brain-computer interfaces BCI is pretty much the same thing. But in practice, when we say BCI, we're usually thinking about a non-invasive system. And when we say BMI, we're usually thinking about an invasive system. But that's just in practice. But whereas if you say BCI, BMI, it's really the same thing. So here's a block diagram of a BMI system. So the first thing that happens is you're collecting data. That's this part. So you see 3 electrode sets here. That's supplying information here, which is transmitted to your recording system. And in the recording system, you have, you have a lot of, I'll put it up to here. You have a lot of signal processing that happens. So this is all engineering here. After the signal processing, you have a decoder. This is the machine learning part. The machine learning part is here. Here is where you interpret these brain signals to mean, like it can be move your hand, move your leg, move your hand up, move the cursor up, move the cursor down. You can decode, you can program anything into this machine learning algorithm. And then comes this computer interface. It can be a computer interface, or it can be an external device, like a robotic arm. So in this case, you see a computer screen where this was actually from a monkey's brain, that they took the information and got the monkey to play a video game. So here's where your artificial intelligence comes in. Okay, so moving on, I would like to show you a short clip about one of the successful, actually one of the first brain-machine interface implementations in humans. This was called the Brain Project. Let me see.
In this paper, 2 people with tetraplegia, that is 2 people who were unable to move their arms or their legs in any functionally useful way, were able to control a prosthetic or a robotic arm simply by thinking about the movement of their own paralyzed hand.
That's a neural engineering.
And they did that using the investigational BrainGate neural interface system. So they thought about using their own arm and hand as though they were reaching out themselves with their own limb, and the robotic arm moved much the way their own arm would have moved. One of the long-standing questions, not only in neuroscience, but in neurorehabilitation, is whether the cells in the motor cortex and other parts of the brain, whether they continue to function the same way years after that original injury.
It is possible for people to use their thoughts to control devices, either a computer or a robotic arm. And the way that happens is that we implant a tiny sensor, just about the size of a baby aspirin, just into the surface of the brain, and that sensor pick up the electrical impulses from a bunch of neurons. And each of those little neurons are like radio broadcast towers putting out impulses. And when they get to the outside, a computer translator converts the pattern of pulses into something that is a command.
One of our participants was able to do something that, when all of us saw it for the first time, gave us all pause. She reached out with the robotic arm. She thought about the use of her own hand. She picked up that thermos of coffee, brought it close to her, tilted it towards herself, and sipped the coffee from a straw. And that was the first time in nearly 15 years that she had picked up anything and been able to drink from it solely of her own volition.
There was a moment of true joy, true happiness. I mean, it was beyond the fact that it was an accomplishment. I think an important advance in the entire field.
So that should give you an idea of what it is like, what's happening out there in the field. And these videos are a little bit old. The BrainGate Trials now have implanted several candidates actually now. They come from all over the world, and they've also established now a center in Geneva, Switzerland, which was where I was working earlier. But they started off in the US. Next, I want to share a clinical trial that I myself was involved in. This is using ECOG. So earlier one I showed you was using, you put the electrodes into the brain. So they were using LFPs. Here we used ECOG. It was less invasive, and also it was completely internalized. So if you met this boy that we did the surgery, you would not be able to say that they had a brain machine implant. Whereas this lady here would have, this is actually the connector. This is the connector, but the actual implant itself is underneath here, which is about this size. So you'll be able to say that this person has something sticking out of their brain. actually that poses a lot of hazards. There was one case in one of their clinical trial subjects actually fell down and hit it on the connector itself. He had two connectors on both sides. So these are some of the challenges that they have had. So what we did is we completely internalized the system using something that was developed for cognitive neuroprosthetics, which I'll talk in the next section. We use that same device, but instead of stimulating the brain, we recorded from the brain. This was what the device was. If you're familiar with cardiac cardiac pacemakers, this is the same device, except it's programmed differently as a neuro device rather than a cardiac pacemaker. The second piece of equipment we used was an orthosis. This is used for people who have different paralysis without connecting to the nervous system. So what we did was we modified this one, and we had, so if you buy this device from the market, if you're paralyzed, you won't be able to use it. This is only for partial paralysis. What we did was we modified both of these and we had a completely paralyzed person use it. Here is our team. This is actually the day of the surgery in the operation theater. The three you see on the left are neurosurgeons. The two, myself and my boss here, we are engineers. We don't have any medical training, but we were there in the operation theater. Actually, I was the person who did all the programming. Again, when we talk about career paths, we can go into it. So here's an fMRI of the person's brain, how we decided where to put these electrodes. So what you see in red and green, we asked the person to think about different movements. And it turns out in the brain, there were places that light up just as if this person was moving. So thinking about moving and actually moving created the similar brain patterns. So this is what we are going to target, or what we targeted to collect. Here's a picture of the electrodes, and the actual brain is sitting. So this is sitting on top of the brain. Here's a picture of the day he came to the lab, like a few days after the surgery. He's able to move things. I want to show you after about a week or two, this is that same patient who's thinking about moving something. And so it's a little bit delayed. If you notice, the computer gives the instructions. And even though he thought about it correctly, now the stimulation, he gets a electrical impulse to his muscles that will move his hand. So now he has to position the hand correctly and it will open and close his hand. So he's able to do a lot of fine movements with this. Right, so again, this person is completely paralyzed in the hand. He has some shoulder movement, and which is what he uses to move his arm, but he cannot open and close his hand. He has not done so for years. And the reason this boy is paralyzed is because he had a motor vehicle accident where he wasn't wearing the seat belt. So he got thrown to the front, and it wasn't even a big collision. It was actually a small, the impact was high, but the speed was not that high, which led him completely paralyzed from his shoulder down. So in this one, we gave the command to the hand. In this one, we are giving the command to a external walking device, and he's able to walk using that. So it's the same system. where he's thinking about moving his hand because that's where we implanted the electrodes. So he has to think about moving his hand. But the signal is given to the legs, or it's given to the machine that move his legs. Similarly, we did another trial where we gave the same signal to the computer cursor, and the cursor was moving up and down for him to read email. So this is what the EEG or the ECOG looks like. Once you process the information, these are the power spectrum. This is the raw ECOG. This is the spectrograph. So for any of you interested in neurophysiology, how this work happens is by analyzing this. You analyze this, then you feed this into a machine learning algorithm. You fine tweak the machine learning algorithm, and the result you get is a person walking. The last type of neuroprosthetics I want to talk about is cognitive neuroprosthetics. Here, you're dealing with deep brain structure. So the motor and the sensory happens on the external layer of the brain. And again, since most of you are not familiar with biology, I'm not going to use biological terms. But if you want to know, it happens in the cortex. This is the external part of the brain, but you also have internal structures, deep structures. There's a technique called deep brain stimulation, where you stimulate deep into the brain. So you put an electrode about that level into the brain. This is the signal generator. So again, a lot of machine learning techniques, a lot of research is going in this area to see how best to stimulate. So you record signals from the brain, you process it here. So all the signal processing and the machine learning actually happens in the pacemaker itself, and then you send the signal back to stimulate. So the pattern of stimulating is decided based on the machine learning technique and the algorithm. You have, and most of you, I'm sure, are familiar that the left side of the brain controls the right side of the body. Right side controls the left side of the body. So you have two paths, actually two signal generators and two electrodes that go into the brain to control sides. This is called deep brain stimulation, DBS. This is actually now available in Sri Lanka. This is approved for Parkinson's. Every other disease, they are trying it out. So there are clinical trials for obesity, for Alzheimer's, for psychiatric illnesses like depression. For Tourette's, I'll show you a video of Tourette's syndrome and how a person's life has been changed. You also have other cognitive neuroprosthetics. This is TDCS, where you give a current, an electric current across the brain to reconnect some of the neural circuitry. This is magnetic stimulation or TMS. You can do this also to realign some of the neurons and to reconnect some of the pathways. This is very helpful in diagnostics. Here is a video clip. This is a little bit long, but I still would like to show it to you, of a person with Tourette's. Tourette's syndrome is where you start moving your hands, moving your limbs, start talking involuntarily. So all of a sudden, just think about sneezing. It's like that. You can't control a sneeze. If you try to control a sneeze, your whole brain would start hurting. It's like that for these people, except instead of sneezing, they start hitting themselves. They start hitting themselves to the point that they actually start bleeding. Some of them have black eyes, and you see like how graphic this is. So this is very graphic. I apologize for that. But you'll also see, again, this is like one extreme, but you see how much neuroprosthetics can help a person. In other cases, some of the lesser symptoms are they start talking involuntarily, they start cursing, they start saying all sorts of things. They can't control it.
You're watching disturbing home video of one of the worst cases of Tourette's syndrome ever recorded. The young man screaming, twitching and convulsing uncontrollably is 23-year-old Tyler Boucher.
I was hitting myself in the face as hard as I could. I broke my own nose, blackened my eyes.
It can impact on all aspects of quality of life. You can't safely feed yourself or dress yourself or toilet yourself. And in many times you need constant supervision.
Just pouring a glass of milk is a desperate struggle. The towel in his mouth is to stop him from biting himself.
Well, he's certainly at the more severe end of the spectrum, and bear in mind that he has to put up with that pretty much 24 hours a day, so it's pretty terrible for him and his family.
Tyler's had this severe neurological condition since he was 9.
I'd yell at my body, at my mind, stop doing this.
Tyler has agreed to undergo a radical and risky procedure called deep brain stimulation.
Deep brain stimulation involves us implanting a couple of very fine wires or electrodes deep within the brain into very specific areas. And what we do is we pass a continuous electric current through that wire and into the brain. And
Dr. Richard Battar is a neurosurgeon who performs the procedure here in Australia. 2 electrodes are placed deep in the brain, where faulty neurons cause the Tourette's. The probes are connected to batteries that are put in the patient's chest. The electrodes basically reset the misbehaving brain cells, hopefully making the tics disappear.
We know that we're in the right area.
Just look at how quickly this patient's tremor stops when Dr. Battar turns the electrodes on.
It's wonderful. Stopped.
If it works, and it does work in probably most patients that it's done on, it can really transform their life.
It's given me back a lot of independence. I can drive to the shops short distance, and I can drive around. I can even take myself fishing.
Stuart Chan was just 8 years old when the first signs of Tourette's started.
My eyes started blinking and I couldn't control it, and I started snorting like that, and then I developed the twitch, and I couldn't control it no matter how hard I tried.
Stuart's a keen fisherman, but even out here, he can't stop the tics, the snorting and the constant jerking of his head.
They got so bad that I couldn't drive. I had to leave work, couldn't work anymore because the tics were just that bad.
Stuart's wife, Naomi.
So he'd be really depressed and hitting his head against walls and hitting doors and smashing his arm in a doorway. So the rage was the scariest bit.
In a desperate bid to regain control of his body, Stuart also decided to undergo deep brain stimulation. It was done by Professor Peter Silburn.
It's always risky, there's no doubt about it, and it must be understood that there is a significant risk, but there's also a chance that it may not work, and sometimes it doesn't work.
There's one of the batteries, which is very much like a pacemaker, and I have 2, one on either side. And yeah, you can see the wires running up and around to the side of my head and inserted into the electrodes into the top.
Stuart's tics haven't totally gone, but he's back to driving and cooking. And best of all, he says, he's going to be a dad.
And now with this technology, it's allowed us to make the decision to have children. So it's changed our life.
To give Stuart his more control over his brain and stop that awful electrical storm and noise that hits it, that's just a huge win. No doubt about it.
Okay, any questions up to now?
Actually, there's a question in the chat box. I can read it. Can brain-machine interfaces be evaluated quantitatively using information theory? That's the first question.
Yes.
Shall I read the second question too?
Yes, sir. First question is yes. I'm wondering if I have the notes or information. Yeah, so there's a thing called Dempsey-Schacht theory, DS theory. There you go, I don't know. But there's a whole field, and if any of you were in my machine learning class last semester, Dr. Kamal Premaratne, Professor Kamal Premaratne from US, actually he specializes in this. And yes, so definitely that can be used.
And the second question is brain-computer interface. Yeah, it's related to the first question. So brain-computer interface using radio waves. I think it's question. So she's asking. I think she is asking, can we use radio waves using brain-computer interface?
Can you use radio waves? So can you use radio waves to pass the signal? Perhaps. So the actual brain-computer interface, let's see if I can explain this. So you have the brain. This is a brain. You collect the signal. To collect the signal, you probably can't use radio waves, at least to my knowledge, because the way radio waves work. But you can use optogenetics, you can use electricity, you can use magnetic systems. And then you need to communicate or pass this information to a device, either an external signal or wired onto the person's own body. So perhaps this can be somewhere where radio signals can be helpful.
Yeah. So there's another question. It's about the this question is about higher studies. Should we need a first class to apply for higher studies? What are the necessary qualifications?
I'll take that question at the end because I'm going to be talking about career paths.
Okay. So then I will get. So I have a question, personal question. So you talk about the cochlear implants. So let's assume like this. Let's say in 1 year, we implanted one cochlear implant, and other year we implanted the hearing aid. So you can imagine situation. So is that I mean one so hearing aid and cochlear implant. So that makes the instability in the brain, or it just is it possible? Can we implant both?
You don't implant a hearing aid. A hearing aid is external.
Yeah. Of course. Yeah. Sorry. External. Yeah.
So let me see if I can explain this. So that's the ear, and this is the cochlea. So if you have a hearing aid, that means if you collect the sound waves and you amplify that signal, and then your cochlea is working. Whereas for a cochlear implant, this cochlea is not working. So you have to artificially get this signal. So you have a hearing aid part that does the speech processor, which is very similar to a hearing aid. But you have to convert this into electrical impulses because your cochlea is not working. So if that person is a candidate for cochlear implants, that means a hearing aid won't do anything for that person.
Okay. So let's say that if left ear is used by the external device and other ear is used by the cochlear implant. So what was the situation? So you explained that the same year.
Yes, so for the same year. So again, these are very risky surgeries. So if a person can hear with one ear, most probably they won't have a cochlear implant. They will only have a cochlear implant if both ears are not working. But theoretically, so not practically, but theoretically, having one ear with a cochlear implant and one ear with a hearing aid is not a problem. Like there won't be any interactions with the two. But again, if you have one ear that's going to work with a hearing aid, you wouldn't want to go in for a surgery. Because the risks are very high.
Okay. So we have another question. How that machine sent in the last neuro disease in the video?
Come again, please.
How that machines replace the batteries when they are inside the body, which were mentioned in the last.
Yeah, you do another surgery to replace the battery. Just like anything else.
Neuro disease in the video.
Sorry, Vidra, I didn't hear the last part of the question.
I think the participant get that answer. No, I was suggesting if there are any question he or she can ask related to that.
So
Okay.
regarding the battery replacement, yes, you have to do another surgery. So if you take a cardiac pacemaker, the life is about 5 to 9 years. Usually about 7 years is the average life of a cardiac pacemaker. For a neuro pacemaker also, because a neuro pacemaker, actually both of them have high stakes, that it's also the same range, but it all depends on, I don't think I had a slide for that. It all depends. So the battery is actually used for sensing the nervous system. So sensing the neural activity of the brain requires some type of battery power. So a lot of research is going into how do you minimize that, like low power applications, how do you minimize that battery usage? The second part, the battery actually gets drained a lot, is by the stimulation. When you send the current to stimulate the brain. So if you're stimulating the brain every single moment of the day, this battery will only last 5 years. Whereas if you use machine learning techniques to use this information, interpret it, and only stimulate when it's needed, this battery probably could last 10 to 12 years. So here's where the machine learning can even be like, so already machine learning is helping, but if you use machine learning even further, you'll find that you can reduce some of the risk. You can reduce, like you can completely eliminate another surgery, especially if these people are like in their 50s and they only live up to about 80, you don't want to do another surgery. So once the battery runs out, this part you can leave as it is, but you need, so this is usually, this I forgot to say, this is usually done as 2 surgeries. One surgery is to implant this, and then once a person recovers, you will do this. Because for our patient, actually, we ended up doing the whole thing in one surgery, which was a very long surgery. But usually this part is done while the person is awake. So you don't want the person to be awake when you're doing this, because this is actually a very gruesome surgery. So what you do is you do this part, let the person recover, and after a few days, you implant this. So then for replacing the battery, you only need to remove this one. You can leave this as it is. There's like a connection here. Actually, you can see this connection. There's one connection here, and then there's another connection usually here. So you can only replace the battery part. You typically don't remove the battery and replace it. You replace the whole pulse generator. Actually, now they have rechargeable devices, which are not readily available in the market, and they're very, very expensive, but hopefully very soon it will be readily available.
Okay, yeah. So the next question is, Madam, does EEG affects bad in our nervous system as they interfere signals transmission?
No, they don't interfere with it. Sorry, EEG is only recording. It's the stimulation that interfere. So it's like radio waves. Imagine these are the radio waves. Sorry. These are the radio waves that are going. Nothing is going to happen to this wave if you collect the signal. It's like that. This is the brain. Nothing's happening to the brain. You're just collecting the signal.
Okay. So before going into the next section, I mean, explaining the career field, how to get a career field in neuroengineering, I have a quick question. So you know that in our human body, we have 5 senses. So we can hear, sense, smell, like that. So let's say if we implant some, I mean, prosthetics or some external devices, so it can help human to just say move a thing, control your arm, control your hearing, like it's okay. But we heard that some people, when they lost hearing, the other I mean, seeing is double. I mean, the other senses get higher. So it's like the brain is naturally just, I mean, it just stabilizing itself to other senses, isn't it? So my question is, when we are doing this, these external activities into our human body, artificially, so I mean, is there a percentage of that brain doesn't identify? I mean, that in videos also that we heard that they said, doctors, researchers said that there is some amount of risk. But regarding the brain, I mean, let's say it can if we see some tree, I mean, if we see some color, one person can see like it's green, but other person like it's light green. So my question is that how the brain identify, how we take the brain to identify this difference, what time it usually take. So is it different from part to part? I mean, if it different from ear to let's say if he has ear surgery, it takes a different amount of time. If it takes the arm surgery, likewise.
So there are like lots of questions in that one question. Let me try to, if I miss any of it, you can ask again. But one thing is there's something called redundancy in our brain, and there's also neuroplasticity. Redundancy means that like you have billions of neurons, they're not special, like, how do I explain this? They do have specialized things that they do in different parts of the brain, but at the same time, if one neuron dies, the neuron next to it can still completely function normally. So like you have so much of, this is like a neural network. This is how neural networks actually come into being. So in the neural network, if one node is removed, you'll find out in an artificial neural network, if one node is removed, you'll find out that if it's an adaptive neural network, it's able to adjust its weights in such a way that the output doesn't change. Same thing happens in the brain. Actually, artificial neural networks are modeled after the brain, neurons in the brain. If one neuron dies or one neuron is damaged, you wouldn't even know. There can be thousands of neurons that die and are damaged before you actually find out symptoms that you can't do what you want to do. Another aspect, so that's what we call redundancy. The second aspect is neuroplasticity, which means that different neurons can take on things, like it's not hard-coded. This is like something like hardware, like hard coding something into a program and letting the program learn. So there's something called neuroplasticity where things are not hard coded. So therefore, if one neuron fails to do the job, another neuron can take it on. This also applies to areas of the brain. So I'm going into way too much neuroscience. This also applies to brain sections. So if you have the brain, imagine that this part of your brain, there is some kind of a tumor. So therefore, you have to completely remove this part of the brain. So actually, there's a hole here. I wish I could, let me see if I can draw the hole. So there's a hole here in the brain, huge hole. And these surgeries are not pretty. I don't mind doing the brain-machine interface surgeries, but when it comes to tumor resections, these are very, very gruesome surgeries. So let's say this is removed. The remaining, especially the neighboring parts of the brain, will take over the job that part of the brain was going to do or was doing. So if that is done successfully, then the person can function normally. Maybe they can't do it successfully, 100% successful, maybe only 50%. So then maybe you'll see that the person, let's say this was a part of the brain that controlled the hand, the person is a little slower or cannot use some fingers to the maximum range. Or let's say if you could use the hand like completely 180 degrees, this person might only be able to do 170 degrees. I'm just giving like just theoretical examples. So parts of the brain can take over. But, so this is one of the things that I was talking about in this slide. Why we did this MRI was to make sure that this boy was paralyzed at 16, and we did the surgery when he was 21. So for 5 years, we wanted to see if that same part of the brain will give us the signal that we want. Because it is very possible that when we did this fMRI, if we didn't see anything light up, that means that part of the brain is completely dead or taken over by, or that has taken over something else. So in this case, what we saw was that it was still intact. In most patients, it's still intact, but it might shrink. So this I haven't studied to tell you exactly, but maybe for a healthy person who's not paralyzed, the area may be that big. But for a paralyzed person, maybe it has shrunk because other things have taken over this part of the brain. So that's very possible. Hopefully that answers.
Yeah. Okay. Sure. Okay. Okay. So.
Okay. So let me move on to the neuro rehabilitation
Madam,
side.
I have a question.
Another aspect. Yes,
you can
go
ask,
ahead.
please.
So there, I have heard from many sources that microwave is not good for cooking because of the method used, that vibrations and all, water vibrations. So in MRI also it uses the same method as you said. So does it have an effect on the humans in a large manner? Because even the food we eat in the microwave isn't good for humans. If it does contact with the brain, I think there must be a big impact, because this was found recently. And what is the impact for the MRI system because of that?
Thank you for that question, because but it's a little bit outside of the scope, so I'll answer it like this. Microwave technology and MRI technology are very different. They might work in similar ways, but they're completely different. Like you can look at the electromagnetic spectrum, you can look at where microwaves are. Whereas what MRIs does it's just a very strong magnet. So imagine like a magnet that you have. So they do a lot of therapies now, especially in the Eastern world, with magnets. You have different magnets that they keep in different parts of the body to heal. MRI is like that, except that it's a huge magnet. And using that, water molecules will align. They're not going to vibrate. They're going to align the north, not the north, I guess, yeah, to the magnetic north. And through that, you're taking the images. I can't say that it's completely risk-free, but what I can say is up until now, research has found that it's free, it's risk-free, and therefore it's even used in pregnant women. Whereas CTs are not used because it's X-ray technology. It is possible that some research is done tomorrow and they find out that MRIs are also not as safe as we thought they were. But up until now, it's completely safe. But the risks, there actually have been patients who have died, who have gone to MRI scans, but all of that had nothing to do with the actual scan itself, but safety aspects, because somebody didn't follow the safety protocols, therefore people died. Up until now, there has not been any research findings about the dangers of MRI from the actual test itself.
Madam, just I want to clear that concept, because this also I have heard that not to build houses or anything near the high voltage wires because of the magnetic interference. So is that concept true? Because I want to
there are a lot of aspects when it comes to high voltage, building houses near high voltage. Again, not being a specialist in that area, but having lived in such an area, I can tell you I definitely don't want to live in such a house again for a lot of reasons. But there's a huge difference. The MRI, you're subjecting the person for like 1 hour. Like usually these tests are about 45 minutes. If you do the brain, depending on what you want to get out of that test, these are very limited time. They're not the tests that go for 24 hours. And usually you don't go back for repeat MRIs every day. You do an MRI now, you probably won't do another MRI for months or years to come. And sometimes it might be once in a lifetime. So therefore, it doesn't have the same kind of risks that some of the other constant magnets have.
Okay, thank you, madam.
Okay, so let me continue with the, because we only have about another half an hour. Neurorehabilitation is another area that you can use machine learning and artificial intelligence. Actually, a lot of research is being done. Virtual reality and augmented reality is now being used for neurorehabilitation. To use, actually, we might very soon bring this to Karapitiya too, as a research project, to see how we can get, so a lot of the rehab therapies that are available don't look at the brain. They only look at, like, whether it's a hand or a leg or speech. They focus on the output. The output is the speech therapy or the hand therapy or the walking, whatever that is. Neurorehabilitation connects all of these with the brain. Because all of this, if you think about stroke, all of strokes happen in the brain. So we want to get the brain involved in the rehabilitation. The Neuro Rehab Center in Sri Lanka is actually within the neurotrauma unit in Colombo. A lot of times physiotherapists, if you have an institute for physiotherapy, they'll incorporate neurorehabilitation into it. Talking about research tools, again, I'm not going to focus too much on these, but a lot of research, especially when it comes to engineering and IT, can be done developing tools for diagnostics for research and for research. For example, like organ on a chip, you may have heard about, like they develop like whole human body organs in a small chip, like a IC. You can also have, this was actually a navigation system, how to, I talked about deep brain stimulation inside the brain. So if you see pictures of the brain, you'll see there are different colors. But when you open up the brain, everything is pink and red. Pink, the flesh is pink, and if you have any blood that has been spattered, it will look red. But you don't have the different colors marking the different areas of the brain. So machine learning can be used to target where the electrodes should go. So neuronavigation is one of the areas that you can focus. Usually, typically, what you do is you'll have a neurosurgeon, you'll have a radiologist, and you'll have the engineer, all of them sitting and discussing where to put the electrode. But once you go into the surgery, 100% it relies on the engineer. The surgeon will rely on the engineer to tell him or her where to put that electrode. So I have been in such surgeries, and after about few surgeries, it gets boring. So what have engineers done is they have completely automated this. Because whatever that you need in the OR, it's in the operation theater itself, can be automated. So rather than having an engineer's valuable time there, and of course these equipment costs maybe like 6 times more than the regular device or the regular equipment, but it can be done. Here's like artificial intelligence being used. Just wanted to show you some other pictures of surgeries, and animal surgeries itself is actually, some of these tools are being used in animal surgeries. Other things that engineering can be used and machine learning can be used is for modeling, mathematical modeling, and then you have to actually code this into a program. I'm going pretty fast because I want to leave some time at the end also for questions. Cosmetic neurology. So we talked about how we replace the nervous system, we repair the nervous system, and the third part was enhancing the nervous system. So enhancing the nervous system is what we call cosmetic neurology. You don't have a disease, but especially in Europe, these are being used. You can either have electricity pass through your brain, or you can have a magnetic field that you put the brain in or the person in, and through this you can increase some of the neural activity. They say that it improves memory and it enhances memory, but unfortunately I can't speak about it because it's not to repair or replace the nervous system, and it's completely in a different area. It's in cosmetic neurology. This doesn't come under FDA, like the NMRA. Like FDA is the US body that's responsible for looking at the quality of these devices. NMRA is the one in Sri Lanka. CE is the one in Europe. So it doesn't come under any of these regulatory processes. So because of that, no one knows the safety of it, but the current or the magnetic field is very, very low to a point that you don't even feel it sometimes. Actually, the TMS, the magnetic one, you might feel a little bit, but the electric one, you barely feel it. But it does change something in the nervous system. So one of the huge things in research is to get these devices, the cosmetic neurology devices, regulated. So if any of you do have access to it, I don't recommend any of this because none of these devices have gone through regulatory processes. And finally, we come to the ethical considerations. So especially if you talk about cosmetic neurology and now you realize like how much danger can be done, you really need to think about the ethical aspects of neural engineering. If you are somebody who works in this area, whether it be through machine learning, artificial intelligence, or by developing a research tool, you cannot say ethical considerations are for somebody else. I'm only developing the hardware or the software part. That's not going to work. Whoever that's working on this needs to be aware of the ethical considerations, because if you just have an ethical, there's nothing as an ethical specialist actually. Somebody who's a specialist in ethical areas, that person can only be a specialist if you know about the hardware and the software components. Okay, so any questions up to any of the stuff that I've spoken about now? I have the career paths, how to get into this area next, but I'll give about 2 minutes for questions of things that I have spoken up to now.
There is a question in the chat box. Wouldn't MRI be unsafe for patients who have implanted any equipment inside their body? Cochlear implant.
Short answer is yes. If you have any metal implants, even metal tattoos, some tattoo ink has metal in it, so you can't have. So if you go for an MRI scan, they'll ask, do you have tattoos? Do you have metal implants? Some have gold teeth. Even earrings are not allowed. And these are some of the safety hazards that I was talking about.
Yeah, I think she got the answer. So yeah, you can proceed, madam.
Okay. So talking about careers, and at the beginning of this, I gave a short introduction of how I got into it. And I believe that I was, so I have worked here in Sri Lanka in 2 different companies as an engineer. I have worked overseas in a company in USA and a research institute in USA as well as in Europe. And I think the demand for me, if so to say, that people were seeking out actually, yeah, most of the jobs that I got, other than for my PhD position itself, PhD I applied for, but most of the others, the people called me and asked me for jobs, asked me if I would like to come for their job. Part of the reason is that I was good in the engineering aspect. I don't know a lot of biology. I learned the biology once I started my PhD, but the engineering, the math, the programming, that aspect, you should know well. So in Sri Lanka, the way the education system is set up, you don't have a lot of opportunity to learn both medicine or biology and math, because at O levels you have to pick one or the other, and if you don't pick math, physics, and chemistry, you can't do engineering. So because of that, you don't have the option of taking a fourth subject. But that math, physics, and chemistry knowledge you should have, you should be experts in. That's what I'm saying, at least to your level. At an undergraduate level, you should know. So this is a foundation, because biomedical engineering or neural engineering is an engineering discipline, not a medicine discipline. So nobody will ask a medical doctor or a medical specialist to know any of these things. They now have neurologists being trained. Remember, I said it's the it's the neural engineer who has to decide where the electrodes are going to be placed during the surgery. They do have neurologists who come from the medical side being trained now for that very specialized task. But what they realized, at least some of the engineers realized, that it was easier to develop algorithms to do that rather than taking the valuable time of neurologists, because neurologists are needed for a lot of other things. So now what they have done is they have developed algorithms for this. Okay, so talking about some other subjects, mathematics, especially linear algebra and statistics. If there are any first-year students or students who are wanting to get into university, please pay attention in your mathematics classes. Programming, I know programming seems like a joke to most of you in your first year, but please pay attention, and it doesn't matter what language you learn, because I learned C++ in university. But then I barely use C++. Whatever language it is, you have to learn. If you learn, if you learn one language properly, it's the skills that you learn that will be used to learn another language. So one of the most widely used languages now in this area is Python, because it's open source and you don't have to pay for it. MATLAB was used before, but it's getting less and less popular. If you're doing any type of prosthetics or robotics, you also have other types of programming coming in, C and C++, things like that. Mathematical modeling, I showed you one little figure of a mathematical model, but all of this has mathematical modeling involved. Then coming to engineering classes, you need signal processing. Analog signal processing, digital signal processing. Some of these, we have kept it in your second year because you need to learn the basics. Some of the analog signal processing techniques you have already learned at A levels. So please don't forget those. Then when you come to like third and fourth year, you'll have the opportunity to study machine learning. One of the reasons we have put it to higher classes or final year is because you need the mathematics and signal processing background in order to learn machine learning. It's a lot of students now just download some machine learning technique and apply it without having an understanding of what is happening. We don't need machine learning scientists like that. Data science also is another area that you need machine learning for. Robotics and AI. So if you ever get the chance to experiment yourself or get involved in some of these robotics clubs, I highly recommend it. Ethical implications of neurotechnology. You won't have a class or a subject talking about ethical implications of neurotechnology, but you will have modules that talk about ethics, which actually, at least in IESL accredited degrees, ethics is mandatory. And actually very soon, in order to get IESL membership, you will need to sign an ethical declaration. So this is very important because it's not just about what is right or wrong, but it's about how do I think about how these technologies are affecting human life, affecting future generations, affecting people who don't get these neuro devices. What are the implications? So all of those need to be studied. regulatory aspects of medical devices, I talked about how in cosmetic neurology, none of them are being regulated. So therefore, we don't know the safety of it. Whereas when it comes to medical devices, they're all being regulated. So if you are working in this area, you need to have an idea. So in Sri Lanka, you don't actually, world around, you don't get a lot of opportunity because this is a very specific area. If you do have the chance to listen to some of these talks or even go online and search, I highly recommend it. Listen to what the MOH is saying. Listen to whatever the NMRA is putting out. Go to their websites. Look at what the current technologies are and how they regulate it. So it might not be taught to you as a separate subject, but you need to know this. You need to have that knowledge. And then finally, I put this last because it's the least important, but it's still important. I'm not saying it's not important, but it's probably the least out of them is the biology aspect. So when it comes to neural engineering, you need to know neuroscience, neurophysiology, and neuroanatomy. Again, you might not get the chance to learn this in the university or at A-levels if you're in either IT or engineering. And I do know that some technology stream students have a little bit of biology and maths both, but unfortunately that maths and biology both are at a surface level, so you need to go a little bit deeper than that. There are lots of YouTube videos. Actually, most of the videos that I have taken today are from YouTube. So you can search YouTube in your free time and learn some of these if you're interested. Don't wait for somebody to teach this stuff to you. Okay, so career paths for a neural engineer, where can they go? I've put research and innovations at the top. You can have your own startup even. You can build devices, you can build algorithms, you can make software programs, like the sky is your limit. You can go into design aspects. We talked about rechargeable devices, like each of these, like think about any problem that you have with these neuro devices. I guarantee that there is a company already working with it. Doesn't mean that you shouldn't start another company, but at least you will find anywhere in the world, there'll be something for you. Programming, we need a lot of programmers. So programmers usually don't know the engineering aspect and the biological aspect. So if I talk about programming, this is what the programmers will study. Maybe a little bit of this, maybe a little bit of this, but not a lot. So if you're a computer programmer, you do have a lot of opportunity in this area for pure programming, but you can definitely increase your value that the value that the company has for you. I don't want to say your value because your value doesn't depend on what you study, but you can definitely increase your value for the company by learning some of the other aspects. Data scientists, equipment engineers, you can go into the advertising field. There's a whole area called neuromarketing. You can be a clinical engineer. There's always an engineer from each company that is present at the operation room during these surgeries. You can be a medical physicist. More and more medical physicists are required to know engineering. So actually the program that I studied at University of Miami had a specialty. If you wanted to learn, if you wanted to go into radiology, you had a special program on top of the PhD in biomedical engineering. You could do an extra bit to be a medical physicist, and you would have to go to an internship in the hospital like medical doctors do. And it's limitless. Okay, so just to summarize, we've talked a lot about neural engineering. We've talked about neuroscience, engineering, how neural engineers don't work in a vacuum. We work with other professionals. And we also talked about how different, and actually during the Q&A some of the questions that you asked. We talked about advantages and disadvantages. We talked about some of the tools. And at the end, I talked about how you must consider the ethical aspects. You must consider the regulatory aspects of these. Okay, that brings us to the end. Sorry, I was going really fast at the end to at least leave 5 to 10 minutes for questions. And actually, let me also do a little bit advertising. We do have a research assistant position available for an MPhil at University of Ruhuna Department of Electrical and Information Engineering. We'll post the advertisement next week. So if any of you are interested, of course, you need to have a minimum bachelor's degree. Sorry, that question that someone was asking. Typically for higher studies, you will look for a first class or a second class upper. So even for this MPhil, we are looking for a first class or a second class upper. But if you only have a second class lower, we might consider you if some of these subjects you have performed well and you show that you have a good grasp of some of these knowledge. Even for higher studies, so I went directly from my bachelor's to a PhD. If you have a good GPA, you can do that. If your GPA is not enough, then typically you would do a master's program, an MPhil or an MSc, and then go for higher studies.
Yeah.
Okay, thank you.
So, I mean, great explanation, and I mean, I think the audience got a lot of knowledge about the neuroengineering. So, and another question. So you can ask any question by unmute yourself. So this question is about this: is neural engineering is a minor discipline in biomedical engineering?
Yes.
Okay,
it depends
so,
on, the short answer is yes. It depends on, I guess, the department that's teaching it. So for example, in our university, at University of Ruhuna, we don't have a biomedical engineering department. We have an electrical engineering department where we teach biomedical engineering as a subject. And a lot of students are doing final year projects related to biomedical engineering. And in that, there are a few students doing related to neural engineering. So when the department is focusing on electrical engineering, the subject is focusing on biomedical, neural engineering can only be a few lectures. Whereas at the University of Moratuwa, they have a department of biomedical engineering, and therefore they can have a subject to focus on neural engineering.
yeah. So I think he or she get the answer for that. So yeah, other than that, student handbook released yesterday. So the biomedical engineering department, I think it released in the University of Ruhuna, I think also. And I think new A-level
that's
students.
A different program, sorry.
Yeah. So I think that's what she asked in that question.
Okay, right. Okay. But
so,
yes, so anything. So what I want to say is, like I said before, be the best engineer that you can be. So one of the things that has helped me to be a good, so I'm a surgeon for animals. I don't do surgeries on humans, but what has helped me to do surgeries for animals or to be a good surgeon is that I know how to drill properly. I know how to use the mechanical engineering tools properly. I know the safety aspect of it. I know how to drill. If it's a big drill press, a bench press, I know how to use that. The small one, so when it comes to the brain, you have the same equipment in a very minute scale. So be the best engineer that you can be. The biology aspect, yes, you'll have to study, but that's actually the least of your worries.
Yeah, good advice. So that's it. And I mean, great explanation from you, Dr. Prince. So I personally thanks, and my Trinet family, we all thank you to because you have given great knowledge and great overview about this neurotechnology. What are the things that we have to consider when we are going in the career path, like stuff, every stuff. I mean, almost everyone has solved their issues and doubts regarding the neuroengineering. So yeah, so great appreciation from our side too, and audience also will be very happy, are too happy, and they have given many comments and many feedback regarding this session. And also I have to give an announcement regarding the you know, that Artificial Intelligence Tech Talk series. This is the 1.2 milestone. So before this milestone, we have conducted a quiz on Thursday. So I'm very happy to announce the results of the our quiz competition. Let me share my screen.
Okay. Vidura, is it okay if I leave because I have another lecture at 12?
Okay. So before that, can we get
Okay.
a quick photo? Then you can. I mean, it's easy. Okay. Okay. Can all guys switch on your camera to get a quick photo? It won't be long. So space can. So should I take the photo or how? Okay. Other guys are coming. Okay. You wait. Okay. Some moment.
Oh, good to see the faces. I wish the cameras were on during the talk.
Okay. So I think I should proceed with the photo. Okay, 3, 2, 1. Please. Okay. Okay, madam. Actually,
Thank you.
Thanks for coming. Okay, and yeah, and other than that, we have to announce the winners of the quiz competition. So let me share my screen. I think you can see the screen. So this is these are the winners of the Techaholic quiz competition. So congratulations to the first place, second place, and third place. So over 100 participants have faced this quiz competition. So it's just a quiz, just a normal quiz to rewind the knowledge that you have gained with the previous session. So congratulations to all winners, and we will be providing the certificates today evening itself. And yeah, so stay tuned with us. And we are apologizing from my side and our side too, because of some network interferences has occurred. So yeah, and let's meet with another milestone. And in next week also we have some surprising event in middle of the week. So be ready, guys. It will be released soon. And yeah, so yeah, stay safe, guys, and stay tuned for our 1.3 milestone. Okay, guys. So see you guys. Bye.